Hi, hello. Ayan, good morning everyone. Good morning, Dr. Alano. My name is Dora Joy Malihor and I'm one of the presenter for this last group, which is Group 8. And today we will be presenting the topic of wound healing. So what is wound healing ba? Wound healing is a vital biological process that restores skin integrity after an injury or damaged tissue. So it involves 4 key phases. Later on, we will discuss these 4 key phases and discuss on how each of these phases plays a crucial role in ensuring an effective recovery. So without further ado, let's start. So what are the contents ba of our discussion for today? So first, we will have the overview of oral wound healing and its importance, and we will discuss the types of oral wound healing and how does wound healing works ba. And we will also discuss the 4 different phases of wound healing, and we will cite some examples and its clinical relevance. Now, let's proceed naman to the objectives. So, what are the objectives ba? So, first, we need to understand how oral wound healing is accomplished by coordinated physiological process. Next is recognize the significance of inflammatory response in the beginning and sustaining successful wound healing. Next is determine the key biochemical variables and mechanism that promotes tissue repair and regeneration. And next is learn about the 4 unique stages or the 4 key stages of oral wound healing, which is the hemostasis, inflammation, proliferation, and remodeling. And lastly, use the knowledge of oral wound healing mechanism to enhance patient care and results in clinical settings. So basically, we will use the knowledge, the learning today for our future. So ayan, now let's go to the lesson proper now, which we will discuss first what is wound healing, the term wound healing. So wound healing is a complex dynamic process of replacing the vitalized and missing cellular structures and tissue layers. So basically the repair or the healing of the damaged or injured body part or tissue layer back into normal. So in the human adult, wound healing process can be divided into 4 distinct phases. So this is the 4 key phases or stages, which is the hemostasis, inflammatory, proliferation, and remodeling phase. So aside from that, in addition, we have the angiogenesis. Angiogenesis is the process where the body creates new blood vessels. Next is epithelialization. This is the process naman where the body covers the denuded epithelial surface and the production of new glycosaminoglycans or GGs or GAGs and proteoglycans, which are vital to the wound healing. The culmination of these biological processes results into the replacement of normal skin structure with fibroblastic mediated scar tissue. So basically, after all of these phases, all of these other additions, our body put the damaged tissue back into normal and replace it with a scar. Usually, our sugat kasi nagiging scar, diba? So next, we have 2 distinct processes in healing. So first, let's discuss the regeneration. So regeneration is the proliferation of parenchymal cells, and usually the results into a complete restoration of original tissue. So from damage, they come back to the normal or the original tissue itself. Next is to maintain the proper structure of tissue. This cell will under constant regulatory control of the cell cycle. Now, let's discuss naman the second part of the distinct processes sa healing, which is the repair. So, this is the proliferation of connective tissue elements resulting into fibrosis or scarring. So, kung kanina, there's no scarring since it goes back to the original tissue. Here, when the healing occurs or the repair occurs, it results into fibrosis or scarring. So, there are two processes involved in repairing: the granulation of tissue formation and contraction of wound. So, in the process of repair, it involves many cells. So, these are the mesenchymal cells, endothelial cells, macrophages, platelets, and parenchymal cells of injury organs. So, let's proceed naman to the types of wound healing. So, although there are various categories of wound healing, the ultimate outcome of any healing process is the repair of a tissue defect. So, basically, the common ground of every type is just to repair the damage or the tissue defect itself. The primary healing, delayed primary healing, and the healing by secondary intention are the three main categories of wound healing. So these are the types, but there are actually four. So I will discuss the last one later, but this is the three main categories of wound healing. So the primary, the delayed primary, and the healing by secondary intention. So for the first category, we have the primary wound healing or the healing by first intention. So in this wound, the surgical insult results in the mortality of a minimal number of cellular constituents. So basically, maliit lang yung sugat. So it occurs within hours of repairing a full thickness surgical incision. So for the next category, we have the delayed primary wound healing. So it only transpire or happen when the wound edges are not approximated immediately. So this type of healing may be desired in the case of contaminated wounds. So basically, may infection or may inflammation. Ayan. So by the fourth day, phagocytosis of contaminated tissue is well underway, and the processes of epithelialization, collagen deposition, and maturation are occurring. In category 2, the foreign materials are walled off by macrophages that may metamorphose into epithelial cells, which are encircled by mononuclear leukocytes forming granulomas. So usually the wound is closed surgically at this juncture, and if the cleansing of the wound is incomplete, chronic inflammation can ensue, resulting into prominent scarring. So if you have a malaking peklat, basically, kaya nangyari yun kasi hindi talaga naging maayos yung cleansing ng wound. So, hindi siya natapos. Ayan. Next category is category 3, which is the third type of healing, which is known as the secondary healing or the healing by secondary intention. So, in this type of healing, a full thickness wound is allowed to close and heal. Secondary healing results into a inflammatory response that is more intense than the primary wound healing. So, in addition, a larger quantity of granulomatous tissue is propagated because of the need for wound closure. Secondary healing results in pronounced contraction of wounds. Fibroblastic differentiation into myofibroblasts, which resembles contractile smooth muscle, is believed to contribute to wound contraction. These myofibroblasts are maximally present in the wound from the 10th and 21st days. So for the last category, which is the category 4, we have the epithelialization. So this process is happen by which the epithelial cell migrates and replicate via mitosis and transverse the wound. This occurs as the part of the phases of wound healing, which are discussed in the sequence of events in wound healing. In the wound that partially thickness involving the only epidermis and superficial dermis. Epithelialization is the predominant method by which healing occurs. So, ito lang nangyayari if ganun yung sugat lang. Wound contracture is not a common component of this process only if epidermis or epidermis and superficial dermis are involved.
Now that we know the overview of wound healing, we'll differentiate between the normal wound healing process and the unique aspects of wound healing in the oral cavity, including the healing of the palate, periodontal healing, dental implant interfaces, dental pulp healing, bone healing, and facial burns. Let's first look at the normal wound healing. This involves several sequential stages: hemostasis, inflammation, tissue repair, and remodeling. The process begins with hemostasis, where blood vessels constrict and clot forms. Next, inflammation sets in to clean the wound and prepare it for repair. Tissue repair involves cell migration and proliferation, angiogenesis, and epithelialization, leading to collagen synthesis and tissue regeneration. The main contributors to this process are epithelial cells, fibroblasts, and vascular endothelial cells, each playing a vital role in the tissue organization and repair. Now let's focus on wound healing in the oral cavity, which has some distinctive features compared to general wound healing. Healing in the oral cavity often occurs more efficiently and with less scar formation. This is due to the factors such as early inflammation, lower levels of immunity mediators, fewer blood vessels, and rapid cell activity. However, the presence of a healthy underlying bone is crucial. For example, in patients with cleft palates, healing can be complicated by issues like perforation or scarring. When we specifically talk about the healing of the palate, we see the oral wounds generally heal quickly. This rapid healing is due to their high turnover of cells and effective early inflammatory responses. However, without healthy underlying bone, complications can arise, such as scarring or incomplete closure. Next, let's discuss periodontal healing, particularly after tooth extraction. Immediately post-extraction, a blood clot forms in the alveolus. Reepithelialization begins within 24 hours, with granulation tissue replacing the clot by the end of the first week. Over the next 8 weeks, bone starts filling the extraction site, and bone remodeling continues for up to 6 months. Factors such as the location of the extraction, adjacent teeth, treatment methods, and patients' habits influence healing outcomes. Plasma concentrates can reduce pain, but don't enhance bone regeneration. Healing around dental implants involves several stages. The process begins with blood clot formation in the implant grooves, followed by granulation tissue development and vascularization. Bone formation starts around 4 days post-placement with optimal bone implant contact achieved by 3 months. Bone remodeling continues for at least a year, influenced by factors such as occlusal forces and implant placement. Dental pulp healing depends on the integrity of the apical blood supply and the odontoblast layer. If the odontoblast layer is intact, it can contribute to tertiary dentin formation. Superficial pulp necrosis can trigger an inflammatory response that recruits stem cells for reparative dentin formation. However, persistent inflammation can lead to pulp necrosis, compromising healing. Bone healing in the jaw can occur by primary or secondary intention. Primary bone healing or direct bone healing occurs without callus formation and requires stable fixation of bone fragments. Secondary bone healing involves callus formation and is more common in maxillofacial surgery. This process includes inflammation, callus formation, continuity restoration, and eventual formation of Ostran's and Haberschen's canal. Burns of the face or inside the mouth often lead to poor healing and significant scarring. factors influencing healing include burn severity, tissue thickness, and vascularization. Ongoing damage to different structures can occur for up to 72 hours post-burn due to the vascular and inflammatory responses. Large defects resulting from congenital issues, trauma, and surgical procedures can present significant challenges in wound healing. The complications can arise from factors such as existing scars, large defects, non-vascularized bone grafts, and poor oral hygiene.
Wound healing is a complex process that is composed of several phases. These phases are often further subclassified into four. This includes hemostasis phases, inflammation phases, proliferative phases, and remodeling phases. So, these stages can also be different as some of the age, nutrition, and chronic diseases can prolong or accelerate the healing process. Likewise, in the oral cavity, sequential oral wound healing is also influenced by the oral environment in pro- and anti-modal fashion through the introduction of saliva, bacteria, and mechanical factors of the urine duct. So first, we discuss the hemostasis phases. So the hemostasis is the process where the blood vessels constrict to reduce blood flow and platelets aggregate to form a clot. This clot acts as temporary barrier to protect the wound and initiate the healing process. Hemostasis is the body's immediate response to injury aimed at stop bleeding. When a wound occurs, blood vessels constrict and platelets gather at the injured site to form a clot. This clot not only seals the wound to prevent further blood loss, but also provides a temporary matrix for incoming cells involved in the healing process. So there are two healing processes involved in hemostasis, which is the immune response and vasodilation. The immune response is vital for protecting the wound from infection. Neutrophils and macrophages are essential for fighting infection. Neutrophils quickly arrive at the injured site to attack pathogens, while macrophages clean up debris and dead cells and release signals to recruit more immune cells and support tissue repair. Next, vasodilation is the widening of blood vessels to increase blood flow to an injured area. This process is triggered by signals like histamine, allowing more oxygen, nutrients, and immune cells to reach the wound, promoting healing and clearing waste products. So now let's go to the second phase, which is the inflammation phase. In this phase of the wound healing process, that includes in the oral cavity, it serves as a body's immediate response to injury or infection and plays a key role in defending against pathogens, removing damaged cells, and initiating tissue repair. So it is characterized by redness, heat, swelling, and pain. The inflammation stage is typically self-limiting, meaning it naturally resolves as the wound progresses into the proliferation phase. Anti-inflammatory cytokines and other mediators begins to dampen the inflammatory response. Failure to resolve inflammation can lead to chronic inflammation, which can impede healing and lead to tissue damage. In the oral cavity, inflammation is influenced by saliva, bacteria, and constant movement. While essential for healing, excessive or prolonged inflammation can lead to complications such as infections or chronic wounds. Now, the third phase is the proliferation phase. In the oral cavity is a crucial stage of wound healing. focusing on tissue and regeneration and repair after inflammation. It is a critical stage in wound healing that begins a few days after an injury and lasts for several days. During this phase, the body focuses on rebuilding and strengthening the wound site. So, this phase involves in three processes, which is the angiogenesis, granulation, tissue formation, and epithelialization. The oral cavity's constant exposure to bacteria, saliva, and mechanical stress makes rapid healing vital. Let's now discuss the first part of proliferation stage or phases, the angiogenesis. It is a process by which new blood vessels form from existing ones. This is essential for supplying the wound with oxygen and nutrients, which are crucial for tissue repair. So, angiogenesis is the high vascularity of the oral cavity, requires increased blood supply for healing, stimulated by growth factors. Its purpose is to deliver oxygen, nutrients, and immune cells while removing waste. In the oral cavity, this is essential to prevent infection due to exposure to bacteria and saliva. The second type of proliferation phase is the granulation tissue formation. So, it is a new connective tissue that forms at the base of the wound that rich in fibroblasts and small blood vessels. It may cause damage to oral tissue, disrupts the extracellular matrix, leading to fibroblast activation by growth factors to produce collagen and other ECM components. Its purpose: the granulation tissue forms a protective layer, support tissue growth, and provide structural integrity in the face of constant movement, bacterial exposure, and moisture. The third type of proliferation phase is the epithelialization, which restoring the mucosal surface. The process where epithelial cells migrate across the wound bed to restore the protective mucosal or skin surface. The causes of it is the wounds or dental procedures prompt epithelial cells to migrate and cover the wound, driven by growth factors like EGF. The purpose is to restore the protective mucosal surface, preventing infection and ensuring the oral cavity return to normal function. So, to sum it up, in the oral cavity, the proliferation phase is driven by tissue damage, inflammation, and the oral environment's bacterial presence, saliva, and mechanical forces. Angiogenesis supplies blood for healing, granulation tissue provides the structural support, and epithelialization restores the mucosal surface, protecting against infection and maintaining oral health. So there are causes of proliferation phase. These are tissue damage from dental procedures or trauma. Inflammatory phase signals that release growth during inflammation drives the activation of fibroblasts, endothelial cells, and epithelial cells, the bacterial load, and saliva in the mouth, which increases infection risk, and lastly, the mechanical stress from chewing and speaking, which necessitates quick and durable healing. So now let's go to the final phase of stage of wound healing, which is the remodeling phase, where the wound matures and strengthens over time. In this phase, the scar tissue forms and the wound continues to heal over time. It includes the collagen remodeling, scar formation, and functional recovery. In the oral cavity, this process is often more efficient and less noticeable than in other parts of the body due to its unique regenerative properties. In remodeling phases, there are also three types. First, we discuss the collagen remodeling. The collagen remodeling is the collagen fibers that are rearranged to boost the strength of resultant tissue. The wound contracts as a result of this process. Initially, the wound site is filled with type 3 collagen, a temporary and less organized form of collagen. During the remodeling phase, this is gradually replaced by type 1 collagen, which is stronger and more durable. Collagen fibers are reorganized and aligned according to mechanical forces, which example of that is chewing and speaking, and improving tensile strength. So, the collagen remodeling has a purpose in the oral cavity. It enhances the strength of oral tissue, making them resilient enough to withstand the stress and movement typical in the mouth. Collagen remodeling in the oral cavity occurs faster than in other body parts due to areas rich blood supply and moist environment. Second type is the scar formation. In the mouth, the scars tend to be less pronounced due to the continuous movement and the rich vascular supply, which promotes effective tissue repair. The scar tissue forms as the wound contracts, and collagen fibers are laid down in a more organized structure. The scar tissue in the mouth is often more flexible and less noticeable than in external wounds, though large and deep wounds may still leave minor scars. The third one, or the last type of collagen remodeling, is functional recovery. The oral tissue returns to full function and any remnant scar tissue matures and adapts to the mouth dynamic environment. As the wound heals, tissue cells gradually regain their normal function, including the ability to handle mechanical stresses. Example of that is chewing and talking. And it regrowth of nerve endings, blood vessels, and tissue layers contributes to the recovery of sensation and movement. So in oral cavity recovery, it is due to unique regenerative capacity of oral tissue cells. Functional recovery is typically quicker compared to skin or other external tissue cells. Normal activities such as eating, speaking, and maintaining oral hygiene are often restored without significant impairment, even in the presence of minor scar tissue. So overall, the remodeling phase in the oral cavity involves the three types, which is the collagen remodeling to strengthen the healing tissue. Second, the scar formation that is often minimal and functionally integrated. And third, the functional recovery where normal activities such as chewing and speaking are restored with little to no long-term impact. So, the efficient healing process in the mouth ensures that tissue regain much of their original strength and functionality.
Now that we know the stages of wound healing, let's look closer at how it works on a chemical level. We'll start by examining the role of growth factors, which is crucial proteins that stimulate various cellular activities involved in healing. Growth factors are essential for wound healing as they regulate cell proliferation, migration, and differentiation. One key growth factors is platelet-derived growth factor. PDGF is released from platelets and is vital for fibroblast migration and proliferation, as well as matrix synthesis. It is also plays a critical role in angiogenesis, which is the formation of new blood vessels to supply oxygen and nutrients to the wound. Another important growth factor is transforming growth factor beta. TGF-beta is a multifunctional cytokine that not only promotes inflammation but also aids in tissue repair. It stimulates fibroblast proliferation, matrix synthesis, and angiogenesis. Next, let's shift our focus to cytokines, which are small signaling proteins that regulate key function in wound healing, including inflammation and immune responses. Interleukins such as IL-1 and IL-6 are pro-inflammatory cytokines that play a crucial role in promoting inflammation and attracting immune cells to the wound site. They are essential for clearing debris and pathogens. Tumor necrosis factor alpha is another pro-inflammatory cytokine involved in inflammation and immune cell recruitment. Additionally, granulocyte macrophage colony stimulating factor stimulates the proliferation and differentiation of white blood cells, which are crucial for fighting infections and clearing debris. Let's discuss the extracellular matrix, a complex network that provides structural support and regulates cellular behavior during healing. Collagen is the most abundant protein in the ECM and plays a key role in providing structural support throughout different stages of wound healing. Elastin, another important ECM component, imparts elasticity to tissues, allowing them to stretch and recoil. Fibronectin, a glycoprotein, promotes cell adhesion and migration. Lastly, proteoglycans, which consist of a core protein with glycosaminoglycan chains, help regulate the hydration and mechanical properties of the ECM. Together, these ECM components provide a scaffold for tissue regeneration, making them crucial for effective wound healing.
Clinical relevance. The clinical signs of disturbed wound healing in the oral cavity can take many different forms, which are indicative of underlying problems with the healing process. Prolonged pain, continuous swelling, severe bleeding, or the development of granulation tissues are possible symptoms. Additional indications include delayed wound closure, the existence of infection, or post-extraction complications such as dry socket. These signs and symptoms frequently indicate problems like infection, insufficient blood flow, or mechanical strain on the wound, which calls for immediate medical attention to treat the underlying causes and encourage healing. Alveolar osteitis, also known as dry socket, a common problem that arises after tooth extraction, especially in the lower jaw, where the underlying bone and nerves are exposed because the blood clot ruptures or fails to form properly. When the underlying bone and nerves are exposed, severe pain occurs. Pain goes from the socket to the side of the face along the nerves. The socket gets irritated and swollen. Pieces of food might fill it, worsening the discomfort, and normally starts 1 to 3 days following the tooth extraction if you have a dry socket. Wound dehiscence, a previously healed wound reopening or splitting, frequently as a result of poor healing or high mechanical force. Post-operative bleeding, a common concern after dental operations, especially surgical procedures such as implant placements, periodontal surgeries, and tooth extractions. While some bleeding is to be expected in the first few hours following surgery, severe or protracted bleeding can be a serious problem that has to be treated right away. Bleeding may persist if the blood vessels are not adequately shut. This may happen as a result of inadequate suturing, ineffective use of hemostatic agents, or not enough pressure application. Oral cyst formation. Formation of a fluid-filled sac at the surgical site, which is frequently a result of an ongoing infection or trapped epithelial cells. An oral cyst can develop at the location of a root canal or extracted tooth, causing swelling and requiring surgery to remove. Corpus alienum, or foreign body, a piece of guttopercha, root canal cement, hydroxyapatite granules, or osteosynthesis screws are examples of common corpora aliena in the mouth. A radix relicta, leftover crown fragments, remaining tooth elements, and bone sequesters can all function as corpora aliena and cause persistent wound infections. The process of wound healing is complicated yet vital, and it can be greatly affected by a wide range of systemic and local factors. First, location of wound. Wounds in an area with a good vascular bed heal considerably more rapid than wounds in an area which is relatively avascular. Second, immobilization. If the wound is in an area subjected to constant movement so that formation of the new connective tissue is continuously disrupted, it will result in delayed healing. Third, physical factors. Severe trauma to tissue will cause delay in wound healing. Under certain situations, however, mild traumatic injury may actually favor the healing process. Fourth, local temperature. In the area of a wound influences the rate of healing, probably by its effect on local circulation and cell multiplication. Fifth, X-ray radiation. Data indicates that generally low doses of radiation tend to stimulate healing, while large focal doses of radiation or total body radiation tend to suppress healing. Sixth, circulatory factors. Anemia has been reported to delay wound healing. Similarly, dehydration has been found to affect the healing wound. 7. Nutritional factors. Delay in healing of wounds may occur in a person who is deficient in any of the essential foods. Protein is one of the most important substances, which may influence the speed of wound healing, so as its deficiency results in a delay in the appearance of new fibroblasts, as well as a decreased rate of multiplication of fibroblasts in wounds. Vitamins. One of these, which has been known for many years to influence the rate of wound healing, is vitamin C. It acts through regulation of collagen formation and formation of normal intercellular ground substance of the connective tissue. 8th, age of patient. Wounds in younger persons heal considerably more rapid than in elderly person, and the rate of healing appears to be inverse proportion to the age of the patient. This cause for this is unknown, but probably relates to the general reduction in the rate of tissue metabolism as the person ages. 9th, infection. Wounds which are completely protected from bacterial infection heal considerably more slowly than wounds which are exposed to bacteria or other mild physical irritation. However, severe bacterial infection slows the healing of wounds. Lastly, hormonal factors. Adrenocorticotropic hormone and cortisone are substances shown to interfere with the healing of wounds. Diabetes mellitus is one of the most recognized diseases in which there is a significant, clinically evident retardation in repair of wounds after surgical procedures, including tooth extraction. Oral wound healing is a critical aspect of dental procedures. Ensuring that the healing process is optimized can significantly reduce complications and improve patient outcomes. Preoperative risk assessment. This involves identifying factors that may impair healing, such as smoking or systemic conditions. Providing patients with detailed post-surgical care instructions is vital. This should include advice on maintaining oral hygiene without disturbing the wound, as well as guidelines on activities to avoid. Minimizing trauma. Gentle handling of tissues reduces damage and accelerates the healing process. Stabilizing blood clots effectively helps prevent complications like dry socket, which can delay healing. Always ensure the wound is clean by thoroughly cleansing the tissue to remove debris and reduce infection risks. Lifestyle and health management. Promote lifestyle changes, as it is essential to achieving better healing results. Make sure the health of patient with long-term conditions is properly monitored. Constant monitoring and patient counseling. Take care of any concerns that occur, such as infection symptoms or delayed healing, and remind patients of the significance of complying to your care instructions and engaging in good oral hygiene for the best possible outcome. By implementing these strategies, dental professionals can significantly enhance oral wound healing, leading to better outcomes and faster recovery of patients.